The wool sock catches on your heel in the pale light of early morning, and before your foot even reaches the floor, that familiar line wakes up. Deep in the hip, down the back of the thigh, maybe into the calf, maybe all the way to the ankle, with that hot, pulling sting. Stay with that line for a second. Don't fix it yet. Just trace it. Where does yours run when it starts talking? High in the buttock? Halfway down the leg? Or like a wire pulled too tight all the way below the knee? If you're over 50, you may know that line so well you've started planning around it. You sit differently. You stand up in stages. You take the first few steps carefully, waiting to see what kind of day the leg has decided to give you. And because it's been called so many things over the years, tight hamstring, hip arthritis, a cranky back, you may never have been told the simpler truth: that this pathway behaves like a channel when it loses room. The old body maps understood that feeling long before modern clinics gave it cleaner names. That is where Daoyin, the guiding and pulling movement right, an ancient Taoist sequence of slow, breath-led stretches that reopens the stiff, locked hip and leg channel after 50 and restores its glide, enters the story. As a way of persuading the body to release what it has been guarding. There's a reason that matters. A peripheral nerve is not a fixed wire. The sciatic nerve has to move, just a little, sliding several millimeters through its sheath every time the hip bends and the knee changes shape. When that small motion is lost, when the tissues get stiff or sticky, the nerve can become a mechanosensitive nerve. Then ordinary movement starts feeling sharp, hot, or dragging, as if something in you has been snagged. And that is why forcing it so often makes it angrier. The answer is better guidance. Ancient Taoist practice paired motion with a long exhale for a reason. The breath tells the guarding muscles they do not have to grip so hard. That is the first doorway into nerve glide. And today, I'm going to show you how this old chair-based method begins with 2 steps only. Open the gate, then restore the glide. Because the strange part is this: before you ever feel the leg improve, there is usually one hidden place near the back of the hip where the whole line first gets trapped. If this kind of slow, practical bodywork speaks to you, tap like and subscribe so you don't miss the next step. That hidden place near the back of the hip is where a lot of this story starts to make sense. You can feel it without knowing its name. There's often a spot deep in the buttock, almost buried under the bigger muscles, where the whole leg seems to tense before you even move. You lean forward to stand, and something there grips. You turn in the chair, and the line down the leg answers. After 50, that pattern gets more common for a simple reason. The body gets protective. Hours of sitting, shorter steps, old aches you stopped noticing. All of that teaches the hip to hold itself a little too tightly. Over time, the channel loses space. Modern anatomy gives that old feeling a shape. The sciatic nerve leaves the lower spine and passes through the back of the hip where several small muscles live close together. One of them, the piriformis region and its neighbors, can become a crowded crossing. You do not need the names memorized. What matters is this: when that area stays guarded, the nerve does not enjoy its normal travel. Its path gets less smooth. That is when simple things, standing from a chair, climbing one step, reaching for the car door, can wake up that hot pull again. And here is the part many people miss. A stiff hip does not always feel stiff at the hip. Sometimes it announces itself down the leg. That is why this old practice matters. Daoyin, guiding and pulling, was built around the idea that a blocked pathway has to be coaxed open in a way the body trusts. The Mawangdui silk chart, preserved from long ago, shows dozens of these slow forms. They were not random poses. They were paired with breath, direction, and attention. A slow exhale changes the whole mood inside the body. The jaw softens. The belly stops bracing. The back of the hip gets the first quiet signal that it can let go. That is also why I want to give you one gentle rule before we move any further. If a motion makes the burning run farther down the leg, stop there. That is not a moment to be brave. That is information. Ease is what helps the nerve reclaim room. Strain is what makes a crowded pathway feel even smaller. So in a moment, we're going to use a chair and begin the first of the 2 steps. Open the gate. And the move is so small, so almost ordinary, that some people dismiss it before they feel what it does. Then the deep hip suddenly answers. So before that deep hip answers, set yourself up in a way your body can trust. Use a steady chair, the kind that doesn't wobble when you shift your weight. A kitchen chair is fine. A folded blanket under you is fine too if the seat feels cold or hard on the sit bones. Come toward the front edge a little, not perched, just enough that your hips have room to move. Let both feet rest on the floor. If one foot wants to creep back or turn out, notice it. That is useful information. The body often shows you it's guarding before pain even speaks. Take a breath in through the nose if that feels easy. Then let the exhale leave slowly through the mouth. Hear that soft sound if you can. Feel what changes when the air goes out. Shoulders drop a little. The jaw may loosen. The belly may stop bracing. In this old system of guiding and pulling, that quiet exhale is part of the movement, not something added later. It helps downshift the nervous system so the guarded places stop acting like they are under threat. Now do one small check before we open anything. Without forcing, turn your chest a little to one side, then back to center. Try the other side. Then gently slide one heel forward an inch or 2 and bring it back. Do the other side. You are testing flexibility. You are listening for where the body hesitates, where the line pulls, where the buttock feels dense or sleepy or hot. Some people notice one sit bone feels heavier against the chair. Some feel a band in the back of the thigh. Some feel nothing until the foot moves, and then there it is. That difference matters, because after 50, the body often hides the true source by spreading the complaint. The hip is crowded, the thigh complains. The nerve loses room, the calf joins in. One place starts it, another place reports it. That is why this chair work stays small. When a pathway is touchy, big moves often create big noise. Gentle movement gives you a cleaner signal. And one more safety note here, because it matters. If you are already in a strong flare today, make every motion smaller than your pride wants. If the symptom starts traveling farther down the leg, ease off right then. That boundary is part of the practice too. We are looking for a softening, a little more room, a cleaner path for neural excursion, never a dare. All right, feet grounded, hands light on the thighs, breath unhurried. We can begin with the first step now, and the shape of it may surprise you. It surprises people because the first step barely looks like exercise. Keep one foot planted under you. Let the other foot slide a little forward so the heel stays in light contact with the floor. Not far, just enough that the knee can soften and the leg can feel a little longer. Now let that knee drift open a few degrees, as if it is turning toward the same side wall. Your toes can follow a little. Place your hands lightly on your thighs so you do not brace. Then let your chest turn just a small amount toward the bent side as you exhale. Slow and easy, like you are fogging a window. Come back to center on the inhale. That is the beginning of open the gate. If you do it gently, you may feel the work in a strange place. More often it shows up as a deep, tucked away stretch in the back pocket area, or a quiet unwinding under the buttock. Sometimes the line down the thigh speaks first. Sometimes the breath changes first. In this old guiding and pulling method, both count. The movement is asking the crowded hip to stop gripping the pathway so hard. It is small on purpose, because a guarded hip listens better to a whisper than to a shove. Try that shape 2 or 3 times on one side. Exhale as the knee opens and the chest turns slightly toward it. Inhale as you return. No bouncing. No pushing the leg wider with your hand. The heel stays in touch with the floor so the body feels supported. If your back is sensitive, make the turn almost invisible. If the knee does not like rotation, shorten the slide and think of the motion beginning in the hip socket, not the lower leg. You are allowed to make this tiny. Tiny is still real. There are two mistakes that show up right away. The first is leaning hard to chase a bigger sensation. When that happens, the low back often takes over and the deep hip never truly lets go. The second is holding the breath without noticing. The jaw tightens, the ribs stop moving, and the whole area gets more defensive. If you hear your exhale and feel your shoulders drop even a little, you are closer to the mark than the person forcing range. And then there is the easier version, which matters more than people think. If even that small opening feels too much today, keep both knees more forward, slide the heel only a finger's width, and imagine the turn instead of performing it fully. Sometimes the nervous system responds to the suggestion before it responds to the shape. Do a few more, slowly, because the mistake almost everyone makes next is the one that turns relief into irritation. That next mistake is subtle, and it shows up the very second the hip begins to feel a little freer. You get one decent breath, one small softening in the back of the hip, and the mind jumps in. It wants more. So the heel slides farther, the knee drops wider, the chest twists harder, and suddenly the deep ache changes character. It stops feeling like a quiet opening and starts feeling sharp, busy, crowded again. That is the body telling you the message got too loud. A calmer response is the prize, so stay in the middle of the motion. Think of it like tuning an old door hinge. A little oil, a little movement, then wait. You do not kick the door open. The same thing happens here. When the exhale is slow and the turn is small, the muscles around that crossing start to release their grip in layers. The outer hip may soften first. Then the sit bone feels less pinned. Then the back of the thigh stops bracing so hard. That order matters because what you want from open the gate is space. Here is a simple way to check whether you are in the right zone. After 2 or 3 repetitions on one side, pause in the center. Keep both feet on the floor. Notice your breath. Notice the pressure of the chair under you. Ask one plain question. Does the painful line feel louder or quieter? If it is louder, reduce everything by half. Shorter slide, smaller turn, softer exhale. If it is quieter, even by a notch, stay there. That is enough for today. Older bodies often change through smaller signals than people expect. And if one side feels almost impossible, use an even easier variation. Place a rolled towel under the working thigh so the leg feels supported from underneath. That can make the hip feel safer. Or keep your heel closer in and let only the knee suggest the opening while the chest barely follows. A supported version still counts. The nerve and the surrounding tissue only care whether the area feels safe enough to loosen. Now, once that first step has taken the edge off the crowding, something important changes. The pathway may have a little more room, but it still has to remember motion. A freed space is only half the work. This is where many routines stop too early. They open the area, then never teach the line how to travel through it again. And that brings us to the second step, restore the glide, which feels even smaller than the first and matters even more. That second step matters because space alone does not teach the line to move again. Once the deep hip feels a shade quieter, bring both knees forward and return to a steady seat. Keep one foot flat. Let the other heel slide ahead on the floor just enough that the knee can lengthen part way, not lock out. From here, the motion is very plain to look at. As you breathe out, let the heel drift forward a little and let the toes soften away from you, like you are reaching through the front of the shoe. As you breathe in, let the knee ease back and the toes come gently up. Out breath, the leg lengthens a little. In breath, it softens back. That is restore the glide. It does not feel like the stretches people are used to. There is no big pull to chase. What you are inviting here is a small change in position at one end of the pathway, then a release, then the same quiet invitation again. This is how nerve glide begins to return. The sciatic line has room to make its small travel through the tissue instead of being held in one irritated place. For some people, the feeling is almost underwhelming at first, which is why they miss it. They expect drama. What often arrives is a cleaner path, a lighter back of thigh feeling, or less of that grimacing tug when the knee starts to straighten. Go slowly enough that you can hear your own breathing. The heel can whisper over the floor. If you are on wood, you may hear a faint, dry slide. If you are on carpet, the shoe may drag a little. That is fine. Keep the movement smooth. No snapping the knee straight. No pulling the toes hard toward your face. We are giving it a chance at calm neural excursion, one gentle pass at a time. And there is one mistake here that matters more than all the others. People often feel a pull behind the knee or in the calf and decide that stronger must be better. So they stiffen the ankle, lock the knee, and hold the leg out too long. That turns a helpful motion into a provocation. If the pathway becomes more irritable or the burning travels farther down, you have crossed the line. Come back at once. Make it smaller, less reach, less ankle motion, softer breath. If even this feels too exposed today, keep the heel closer and move only through a tiny arc, barely enough for someone across the room to notice. That still counts. The body responds to quality long before it responds to size. Now, do it once more, very slowly, and pay attention to what changes in the first few passes, because this is usually where the leg tells you whether it remembers the way. That first response is often quieter than people expect, so you have to know what you're listening for. You may not get some grand release. You may not feel a dramatic stretch at all. What often changes first is the quality of the line. The back of the thigh feels less ropey. The calf stops buzzing quite so much. The deep spot in the buttock no longer feels like a clenched fist. Sometimes the change is even simpler than that. You straighten the leg a little, and there is less hesitation. The pathway feels less sticky. That is the body's early sign that the glide is returning. And sometimes, just as important, you learn that today is not the day to push. A mechanosensitive nerve will tell on you fast. The pull sharpens. The heat travels lower. The leg starts to feel more alert in the wrong way, as if every inch of the root is bracing for the next move. If that happens, shrink the motion right away. Bring the heel closer. Reduce the ankle change. Let the exhale get longer than the leg movement. It is skill. You are teaching the tissue that movement can happen without alarm. This is also why older bodies often do better with rhythm than with effort. A small forward whisper of the heel on the out-breath, then a return. Again. Again. Nothing sudden. If the chair creaks beneath you, you are probably shifting too much. If your shoulders climb toward your ears, the body is trying to help in the wrong place. Let the hands rest. Let the face soften. The less extra work you add, the clearer the message through the hip and leg channel. Now put the two steps side by side in your mind. First, you made room in the back of the hip. Then, you asked the line to travel through that room. That order is why this old method works so well in a chair. It respects how the body organizes itself. Release the crowding first, then restore motion. If you reverse it, the path is often too irritable to cooperate. So try a short round now on one side only, a few easy openings, then a few glides. Pause. Sit still for a breath. Notice whether the sole of the foot feels different on the floor, whether the leg hangs a little heavier, whether the ache has changed its shape. Because once you compare one side to the other, that is where people usually feel the first real surprise. That comparison is worth slowing down for. After one side has had a few easy openings and a few glides, bring both feet back under you and just sit there for a breath or two. Feel the chair under both hips. Feel the soles of both feet. One side may seem more settled, as if the leg has dropped a little more weight into the floor. The other may still feel held up, guarded, unfinished. Sometimes the difference is not dramatic at all. It can be as small as one thigh feeling less busy, or one buttock no longer clenching against the seat. Those are real changes. Now stand if that feels safe for you. Use the chair if you need a hand. The first rise tells you a lot. Does one hip stop arguing as much? Does the leg line wait a beat longer before it complains? If standing is too much today, stay seated and march one foot an inch off the floor, then the other. Again, we are listening for quality. Older bodies reveal progress in these little moments: how you shift, how you load the foot, how much you brace before movement. This is where the old idea of a channel becomes useful language again. A line that was blocked can feel dense, interrupted, noisy. A line that is opening often feels more continuous. The route becomes easier to sense from hip to calf, as though the body can finally tell one story instead of 5 different complaints. Modern terms point to the same thing in another way. When the tissues stop crowding the path and the nerve resumes a more natural travel, the whole leg often feels less defensive. Now do the same brief sequence on the other side, even if that side is not your problem side. That matters. The body likes contrast. It learns from symmetry. And sometimes the so-called good side is not truly free either. It is just quieter. Give it the same courtesy. A few calm openings. A few smooth glides. Let the breath stay slower than the motion. There is also a subtle mistake here that catches a lot of people. The moment one side feels better, they rush through the second side just to get back to the relief. Don't. The body notices speed. When you hurry, the breath shortens, the jaw tightens, and the hip starts guarding again. Keep the same pacing on both sides. Chair steady, heel soft on the floor. Exhale, carrying the motion. And when both sides have had their turn, sit for one more moment before you test anything else. Because the next thing you notice may not be pain at all. It may be space. That sense of space can be easy to miss if you only look for pain. Sometimes the first thing that changes is how you sit in the chair. One hip no longer feels welded down. The leg that always wanted to tuck in or swing out can rest more neutrally. The waistband stops feeling twisted. Even the foot may meet the floor more fully, with the heel and forefoot sharing the load instead of the whole leg hovering in readiness. These are quiet signs, but they matter because they tell you the body has stopped preparing for a threat that is not happening in this moment. This is where people often think, all right, if a little helped, I should do a lot. Morning, noon, night, longer holds, bigger slides, deeper turns. But that is the old bargain again, the one that made the pathway grumpy in the first place. This form works because it restores trust. A pathway that has been irritated for months or years does not suddenly want an all-day project. It responds to brief, calm repetition. A little room, a little motion, then rest. Later, repeat. So for now, think in rounds. One short round can be enough to shift the day. Another later can remind the tissues what safe motion feels like. You need a chair that feels solid, a few unhurried breaths, and the discipline to stop while the body still feels receptive. That last part is harder than people expect. Relief creates greed. Greed creates strain. There is another reason the smaller approach works, and it comes back to how old guiding and pulling was built. The exhale changes the tone of the whole system. The nervous system reads it as a lowering of alarm. That is why the hip often softens on the breath before it softens on the stretch. If you rush the air, the tissue often rushes back into guarding. If you lengthen the air, the body has time to listen. That is why this chair sequence can work for people in their 60s, 70s, even 80s. It asks for attention more than force. Now, if you are wondering how often to do it, hold that thought for a moment. Frequency matters, yes, but what matters first is knowing whether you are doing enough to help and not enough to provoke. There is a simple way to tell. It has nothing to do with how strong the sensation feels in the moment. It has to do with what the line says after you stop moving, and that answer is often the most honest one of all. That answer shows up in the minutes after the chair work, and sometimes later the same day. When you finish a round, judge it by what happens next. When you stand to wash a cup, when you cross the room, when you lower yourself back into the chair again, does the line feel calmer, or does it feel stirred up? A helpful session often leaves a kind of quiet behind it. The body does not keep arguing. The deep hip may still be present, but it is less bossy. The leg may still talk, but it is no longer shouting over every step. An unhelpful session has a different aftertaste. The root feels more alert. The pull spreads. The calf starts chiming in when it had been silent. The buttock feels tightened back down, almost offended. That is the sign that the dose was too large, the pace too quick, or the line was not ready for that much motion today. This is why chair-based work can be so powerful for older bodies. It lets you adjust the dose closely. 1 inch matters. 1 breath matters. A smaller round done well teaches more than a larger one done proudly. So if you finish and feel smoother for even 10 minutes, take that seriously. 10 quiet minutes are evidence. The tissues are telling you they can still change. The nervous system is telling you it noticed safety. And if the improvement fades later, that does not mean nothing happened. It means the body may need repetition before the new pattern starts to hold. It wins by persuasion. You may also notice something curious by evening. A chair that usually traps you may feel less punishing. Getting out of the car may take 1 less preparatory breath. The first step after standing may land with less suspicion. These tiny shifts are often the earliest proof that the hip and leg channel is beginning to reclaim normal motion. They are easy to dismiss because they are ordinary, but ordinary is exactly what you want back. Now, there is a practical question sitting right here. How often should you do it? Every hour? Only when symptoms flare? Morning and evening? The answer is not complicated, but it does depend on one thing you need to recognize first: whether your body is responding to consistency or whether it is still asking for a lighter touch. And there is a simple pattern that tells you which one it is. You can hear it in the first steps after sitting. Those first steps after sitting are a better guide than any stopwatch. If you do a short round in the morning, then sit for breakfast, read, answer a message, or just rest a while, notice what happens when you stand again. Do you unfold a little easier? Does the hot line wait longer before it wakes up? Does the leg feel less like it has to be negotiated with? That pattern tells you the work is landing well. It means the body is starting to remember that standing does not always lead to trouble. When that happens, a simple rhythm is usually enough. Once earlier in the day, once later, both brief, both calm. You are not piling up effort. You are giving the tissues repeated proof that the path can open and move without being punished for it. For many people, that is where progress begins to stick. The first rise from a chair gets easier. The turn toward the kitchen counter feels less guarded. Even getting into bed can lose some of that careful choreography. But if the first steps after sitting feel sharper than before, change the dose before you change the schedule. That is important. People often assume they need more sessions when the real answer is gentler sessions, fewer repetitions, less slide, softer exhale, smaller opening at the hip. Daoyin has a quiet intelligence to it. It assumes the body will tell you the truth if you listen after the movement, not during the excitement of it. There is also a pattern some people notice after several days. The strong flare may still visit, but the recovery from it gets shorter. You stand up and the leg settles sooner. Or the buttock ache comes on, but it does not pull the whole line with it. That is often a sign the tissues are tolerating motion better. The root has not become perfect overnight, but it is less quick to complain. That matters more than a dramatic one-day win. And let me say one thing for the person listening who is in their 70s or 80s, or who has a back that dislikes floor work or knees that object to fancy setups. This chair method was made for real life. A sturdy seat, a quiet room, maybe the low hum of the refrigerator in the next room, the pressure of your palms on your thighs, your own breath slowing down. That is enough. You are not disqualified because your body needs simpler entry points. Sometimes the simpler entry points are the smartest ones. Still, there is one habit that can undo several good days in a single afternoon. It usually shows up the moment you start feeling hopeful, and it sounds like this inside the mind. Maybe I can push it now. That thought is the trap. The body gives you one better morning, one easier stand from the chair, one walk to the kitchen that does not feel like a negotiation, and right away the mind wants to cash it in. You reach farther, you hold longer, you add a deeper twist because surely the line can handle it now. But the tissues that have just started trusting motion are still listening very closely. Hope can make people rough, and roughness is often what turns a calm pathway back into a complaint. This is especially true with a nerve that has been touchy for a while. Once it has been irritated enough to speak through the buttock, the thigh, the calf, or even the foot, it remembers threat fast. That is why the old chair sequence stays so respectful. Open the gate, restore the glide, then stop while the body still feels cooperative. Leave a little in reserve. Let it want more tomorrow. That is a hard discipline, especially if you are used to solving problems by effort. So here is a simple rule for the good days. If you notice clear relief, do not reward yourself by making the routine bigger. Reward yourself by keeping the same calm dose. Let the breath stay slow. Let the movement stay almost modest. The body learns through repetition of safety. It does not learn safety from one bold stretch followed by a flare. If you are ever unsure, choose the smaller version that still leaves the line quieter after. You can even use your surroundings as a guide. If your shoe scrapes sharply across the floor, slow down. If the chair legs squeak because you are shifting and bracing, reduce the effort. If your face tightens, your ribs stop moving, or you catch yourself holding air, return to the exhale first and let the motion shrink around it. The breath is still the governor here. It sets the pace of the whole system. And there is another subtle thing that happens when this work begins to help. People start blaming the remaining stiffness on the wrong place. The hip is improved, so they assume the rest of the line should now feel perfect. But sometimes the hip was only one gate in a longer route. A lower segment may have softened, while something higher up is still tugging on the same pathway. The leg feels better, yes, but not fully free. That does not mean the chair work failed. It means the body has more than one doorway. And the next doorway, the one many people never think to check, is above the hip, where the whole line first begins to take its shape. That upper doorway matters more than most people realize. The line you feel in the leg does not begin in the leg. It takes shape higher up, near the low back and pelvis, where the route first has to pass through a body that may already be bracing. If that area stays rigid, the hip can improve, and yet the whole pathway still feels shortened, as if the leg never quite got the full message. You may notice this as a strange half relief. The buttock is better, the first few steps are easier, but there is still a tug when you stand tall, or a guarded feeling when you straighten after sitting too long. It is a reason to understand what it has already given you. By opening the lower gate and restoring motion through that crowded route, you have made the signal clearer. Now you can tell the difference between a line that is trapped low and a line that is being tugged from above. Before this, everything may have felt like one muddy complaint. After a few days of good practice, the body often becomes more specific, and that specificity is useful. If the hip and thigh ease, but the pull returns when you arch, twist, or rise from a slumped chair, the upper gate may still be part of the story. If the line stays calmer as long as your pelvis sits well and your breath stays low, then flares when the lower back stiffens, that tells you something too. You are not guessing anymore. The pathway is giving you clues. For now, stay with what is already working. Keep the sequence brief. Keep the breath longer than the effort. Let the chair support you instead of fighting to sit upright like a soldier. A rigid posture can be just another kind of bracing. What helps more is a balanced seat, ribs easy, jaw soft, shoulders quiet. The old forms understood this without using modern words for it. The channel opens best in a body that does not feel cornered. And there is another benefit to staying with this gentle method a little longer before chasing the higher piece. It teaches you what your baseline actually is. The smell of morning coffee in the kitchen, the cool floor under your heel, the small pause before you stand from the table. Those ordinary moments become your measuring sticks. Not a dramatic test. Daily life. That is where you feel whether the line is becoming less reactive. In a moment, I'm going to tell you how to read those daily life signs over the next stretch of practice, because that is where people finally understand whether this is just temporary soothing or the beginning of a real change. That change usually shows itself in very ordinary places first. You notice it when you get up from the couch and do not have to pause quite so long before the first step. You notice it when you turn to rinse a plate and the hip does not seize with the same old suspicion. You notice it in the car, in the grocery line, at the edge of the bed. The line may still be there, yes, but it is less dramatic, less ready to flare over every little transition. That is how real progress often enters the body after 50. Quietly, through less interference. So, as you keep this chair practice going, track pain, track friction. How much bargaining is needed before movement? How much bracing happens before standing? Does the buttock feel less dense against the chair? Does the back of the thigh stop announcing itself so early? These are better signs than chasing one perfect stretch. A body regaining ease often looks ordinary from the outside. From the inside, it feels like fewer negotiations. This is also where consistency starts to matter more than intensity. Short round, calm breath, stop before irritation. Later, another short round. That is often enough to teach the hip and leg pathway a new expectation. The tissues begin to expect room. The nervous system begins to expect safety. And when that expectation changes, the body does not have to launch the same protective response every time you sit or stand. Some people feel this within days as a smaller morning complaint. Others notice they can sit through a whole meal without that burning creep down the leg. Others realize the walk to the mailbox no longer has that dragging, guarded first minute. The details vary, but the pattern is the same. The route becomes less touchy because it is no longer being asked to endure the same old crowding without relief. And if progress feels uneven, do not be thrown by that either. Healing pathways are often messy in the middle. One day feels looser, the next day stiffer, then suddenly the body settles into a better average. The important question is not, was every day perfect? It is, over time, is the line becoming less reactive? Is the hip less quick to lock? Is the body less afraid of its own movement? If the answer begins to lean yes, even a little, then you are no longer just soothing symptoms. You are changing the conversation inside the tissues. And there is one last piece that makes this change hold much better over the coming weeks. The moment you stop treating the sequence like an emergency fix and start using it like a daily signal. That daily signal is where the practice starts to change character. At first, you use the chair sequence because something hurts. The hip grabs, the leg burns, the path feels short and irritated, and you want relief. That is natural. But after a little while, if the body is responding well, the wiser use is earlier than that. You sit down before the line gets loud. You do a short round before the long car ride. You use it after breakfast, before the afternoon stiffness settles in, before the evening chair becomes a trap. In other words, you stop chasing the flare and start shaping the day. This is where older bodies often do best. They like predictability. They like calm repetition. A pathway that has become sensitive over time often quiets more deeply when it no longer has to scream for attention first. So the same 2 steps, open the gate and restore the glide, begin to feel less like first aid and more like maintenance. A small opening, a few easy passes, breath slow enough that the ribs can soften. Then you go on with the day before the body has a reason to build its usual wall. And that shift can be surprisingly emotional. When pain has been setting the schedule for a long time, even one part of the day that feels less controlled by it can feel like getting a room in your own house back. You sit without waiting for the burn. You stand without the old little brace. The line is still there, maybe, but it no longer runs the whole conversation. That is a different kind of relief than one dramatic stretch. It is steadier, more livable. This is also the point where people are tempted to stop too soon. Things improve a little, life gets busy, and the routine gets dropped for several days because the crisis seems over. Then the old stiffness sneaks back in quietly. The chair feels harder again. The first steps after sitting grow guarded again. Not because the body failed, but because the signal stopped. Sensitive tissue often needs repetition long enough for the calmer pattern to become familiar. So keep it simple. Let the routine be small enough that you will actually do it. A stable chair by the window, morning light on the floorboards, your heel making that faint whisper as it slides. One slow exhale opening the deep hip. Another carrying the leg into a gentle pass. Nothing heroic. That is part of why it works. And when you hold that rhythm for a while, something else often starts to happen. The body stops reacting only in the chair and begins changing how it moves everywhere else. That is when you begin to notice the change outside the practice itself. You bend to pick up a towel, and the old warning down the back of the leg is softer. You turn in the kitchen, and the hip does not clamp first and ask questions later. You rise from the couch, and the first step is no longer a cautious test. These are small things, but they add up to something much bigger than a single stretch session. They mean the body is starting to carry the lesson forward on its own. This is the real promise inside the chair work. You are not trying to become good at the routine for its own sake. You are teaching the pathway to behave differently between routines. A calmer rise, a cleaner step, less guarding before movement. That is why the old method can feel almost humble while doing it and still create very real change over time. The sequence is small, the effect reaches farther. And there is a practical reason this happens. When the deep hip is less crowded and the line has repeated chances to move without protest, the tissues stop preparing for trouble so early. The body begins to spend less of the day bracing. That saved effort shows up everywhere. Walking across the room feels less staged. Standing at the sink feels less punishing. Even the way you settle into a chair can become less defensive. You are no longer interrupting movement at the same places every time. Of course, some days will still be stiffer. Weather changes, long sitting, bad sleep, stress, an awkward errand, all of that can bring the old line closer to the surface again. But if the practice is helping, those rougher days no longer own the whole week. The flare rises less high. It passes more quickly. the body finds its way back sooner. That is an important difference, and people often feel it before they know how to describe it. So if you are listening for proof, listen there, not just in the chair, in the rest of life. Can you stand from dinner with less hesitation? Can you take those first steps after a phone call without that old pull lighting up immediately? Can you turn over in bed with less of that deep buttock grip? Those are the signs the pathway is changing its habits. And now we are very close to the simplest test of all. No special setup, no anatomy lesson, just a brief before and after moment that tells you, in plain body language, whether this route is beginning to open for you. Sit back down for that, because the way you stand up next may tell you more than any explanation I could give. That moment can be very plain, which is why people trust it. Sit the way you normally sit for a minute. Let the body settle into its usual habits. Feel the chair under you, the pull of your clothes at the hip, the weight of your feet on the floor. Notice whether one foot wants to slide back, whether one knee turns out, whether the line down the leg is already whispering before you even move. Then stand up in the ordinary way you would stand up at home. No special correction, no performance, just rise. That first rise is often the clearest measure because it catches the body before the mind starts helping too much. Does the hip feel less sticky? Does the leg complain later than usual? Does the buttock release you a little sooner? Even if the change is only a small delay in the old pattern, that matters. A delay means space. A delay means the line did not jump to alarm quite as quickly. And that is often the first sign that the root is beginning to trust movement again. Now sit back down and do one brief round, 1 or 2 easy openings, 1 or 2 gentle passes to restore the glide. Keep the breath leading. Let the exhale arrive first, and let the movement follow it. Do not rush because you are eager to test. In this old practice, the calm between motions is part of the medicine too. The chair under you, the soft pressure of your hands on your thighs, the sound of the room settling around you. Let all of that help the body stop defending. Then stand again. This second rise is where many people feel the difference most clearly, not because everything is magically fixed, but because the body has just been reminded of a better option. The path has been given room. The tissues have been given a quieter instruction. The nerve has been allowed a little more freedom to travel. Sometimes the change is in the hip. Sometimes it is lower, in the back of the thigh or calf. Sometimes it is simply that standing feels less ceremonial, less like an event that requires strategy. If nothing changes, that is information too. Make the routine smaller next time, slower, softer, or consider that the upper doorway may be asking for attention as well. But if something does change, even a notch, do not talk yourself out of it. Bodies speak in increments before they speak in victories. And in the final step, I want you to do something simple with that information, something that turns your private result into a map others can recognize too. So do that now. Stand in the ordinary way and let the body answer before the mind explains it away. Maybe the change is obvious. Maybe it is only a breath of difference. The hip lets go a little sooner. The back of the thigh does not grab at once. The calf stays quiet for 3 steps instead of 1. Even that counts. In this work, small changes count. They are the first clean footprints across ground that used to feel blocked. If the line feels smoother, if standing takes less preparation, if the deep buttock does not lock around the same old point, then the body has already told you something important. It can still learn room. And if today was not dramatic, that does not cancel the method. It only tells you to stay gentle, stay observant, and keep the sequence honest. Open the gate, restore the glide, let the breath lead, stop before irritation. That is the shape of it. A peripheral nerve does not need to be conquered. It needs enough freedom to make its small travel again. Once that begins, ordinary movement stops feeling like an insult. That is why this old chair ritual lasts. The silk chart from Mawangdui preserved dozens of forms, but the wisdom inside them is plain enough to feel in your own living room. The exhale softens the guarding. The hip yields a little space. The line takes one quieter pass, then another. Over time, the body trusts that path more, not because you forced it open, but because you stopped treating it like a fight. A stiff root does not reopen all at once. It gives way the way an old curtain loosens on its rod. First a hesitant inch, then another, and one day the fabric moves without that snagging catch that used to stop it cold. The room gets still after that. Your hands fall quiet at your sides. The chair sits where it was, plain as ever, and the floor under your feet feels a little more like floor and a little less like a test. If this reached you, write "path is clearing" in the comments and tell me where your line runs most often: hip, thigh, calf, or heel, and your age range. And if you want the next gate above this one, the spine video is waiting for you next.